The meeting will now come to order. Hello, I'm Marcia Herbert, President of the Board of Education. I would like to welcome you to the September 29th special board meeting. To comply with the recent state mandates, we ask everyone to please wear a mask. In keeping with the board's commitment to open communication with the community, this meeting is being streamed live on the CCPS website at www.carrollk12.org and broadcast live on Channel 21. We are also recording this meeting so that it can be accessed on demand on our website and broadcast throughout the month on Channel 21. Board members and staff are present in the boardroom, so there will be no citizen participation scheduled for this meeting. I remind all of us to silence our cell phones and other devices around us that the microphone may pick up. Also, board members, please turn off your microphones when you are not speaking. Please stand for the Pledge of Allegiance, followed by a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. At this time, I need a motion for the approval of the agenda.
So moved.
By Ms. Pataglia, second by Dr. Dorsey. All those in favor signify by saying aye.
Aye.
Opposed? It passes unanimously. As the Board of Education, our role is to do what is best for our children. And as we all know, what is best for our students is for them to be in school receiving meaningful instruction. We've all seen the quarantine numbers, and these numbers are raising serious concerns. Simply put, we have too many healthy students in quarantine. The purpose in tonight's meeting is for us to discuss these quarantine guidelines because, as we can see, they are not working and they need to be re-examined, as many of our students as possible need to be in school. And thank you. And a little other note, I want to thank everybody for all their notes and emails for a death in our family. So thank you very much. And Dr. Lockhart, you may take that away.
Thank you, Ms. Herbert. Good evening, board members, Commissioner Frazier. As Ms. Herbert said, we wanted, and we sort of outlined this a little bit at the joint meeting, we wanted to outline some of the challenges that we're facing as it relates to the current quarantine and protocol, current quarantine protocols that are in place. We're so excited to have students back. And as I said at the joint meeting, unlike last year, this year on any given day, we have upwards of 95% of our students back in school 5 days a week. And that's great. Because if you asked us this time last year, the answer would have been none. And then maybe about 45%, and then finally we worked our way up, but still never saw 95% of our students. However, while COVID is still very much amongst us and a challenge that we face on our dashboard today, this was just updated, we currently see 248 positive cases in the system. That includes students and staff. It's the quarantine numbers, up to 1,405, that are bringing us here to have this conversation. And while we certainly want to maintain health and safety standards in our system, we're also trying to balance in-person consistent instruction for our students. And what we're going to try to do tonight is talk about some of the challenges related to the quarantine process. And we're so appreciative of Mr. Singer being with us this evening in terms of working and looking collaboratively to find solutions so that we can support one another, that keep our students safe, but also give us that flexibility to keep healthy students in school consistently. And just as an example, and we'll get into some of these challenges this evening, we have some students that have not had COVID, but because of the current protocols have only seen maybe 2 days of school. I talked to somebody today whose child has been quarantined twice. And just in the short amount of time we've been here. And so that has a big impact not only on that student and their teacher, but also their family and their home life and their work arrangements and all the things that go with it. So we completely understand and respect all of the reasons why it's important that we have safety precautions in place. But I think it's our job at this point, now that we've watched this for, several weeks, to come to the table to make some modifications that can support a more consistent approach for our students while trying to maintain safety and health of our students. So I'm going to stop there, and I'm going to call a few staff members up, but I see we may even have a couple.
I was just going to ask, is that 248 that have become positive in 1 week, or is that added from last week?
No, so remember, our dashboard captures anybody who is currently listed as active, so that could be some from last week and some new ones from this week. And once they're not active and back in school, they come off of that list. So I understand sometimes it's not that we picked up 248 new COVID cases. Many of these are going to be holdovers from last week until they're cleared to return. And similar to quarantine, because that process spans typically more than a week, you're going to have some holdovers from last week into this week. So with that, what I'd like to do is ask Mr. Streaker to start the conversation with us. And if you could, Mr. Streaker, I know sometimes in your line of work particularly, there are many, many logistics, but we'll try to give the 30,000-foot view here. What I'd like you to do to explain to the board and really the listening audience is a broad overview of what happens when we have a positive case identified and the quarantine close contact that occurs, and ultimately what that means for students and staff. Because one of the things too that we see is a significant strain of our resources in trying in that process. And so if you could share a little with the group and, like I said, the listening audience of some of the challenge that's been created as a result.
Sure, thank you. And just to kind of, I always take this opportunity when I start something is to thank our nursing staff who are working incredibly long hours and the support that they have from their administrators and other clerical staff to do this work. It's very time consuming and it's a strain. And I just, before I get into that side, I want to take the opportunity to thank them for everything they're doing. Essentially what happens is when we learn of a positive COVID case, the first thing that we do, if that student is in school, they need to go home. And it's pretty rare we learn when the kid's in school they're positive, because they shouldn't be there if they were symptomatic or positive. So most often, it may be a student that we sent home because they weren't feeling well, and the parent went and got their child tested. So that's the typical scenario. When we learn that that child's positive, we have to determine when their symptoms started, and then we go back 2 days prior to that. And this is where our teachers, administrators, bus drivers, we kind of figure out who were the close contacts, who was around that student. With universal masking, it's a 3-foot in the classroom setting. In the cafeteria, we look at a 6-foot distance for the 15-minute cumulative time. And then we identify close contacts. And those close contacts are placed in quarantine. So we're notifying those families. We're making phone calls to those families. There have been times we used email just because we're overwhelmed with the number of people we're calling. So in any specific one case, we might have, we could have as few, maybe as 10 students, but more often it's probably in the 30 to 40 range of students that are quarantined, depending upon, at the middle school level, it might be more. At high school level, it could be higher because the kids mix. And also remember, if the students are vaccinated, they don't need to be in quarantine as long as they are asymptomatic. So that certainly helps us at the secondary level. So the students now, they're home. Obviously, the sick student is home. We have our teachers are setting up their Google Classrooms so kids can access. In many of our schools, we're struggling to get onboarding all of our quarantine success coaches to try to engage those students and support them. And so our sick children as well as our quarantine kids are home. And we're trying to educate them and provide whatever we can resource-wise. And then we have different scenarios for them to come back from quarantine. So if a student, from the day of exposure, they can get tested within 5 days. If they get a negative test, they can return on the 8th day. If they choose not to get tested, they can come back on the 11th day because they need to be in quarantine for 10. So there's some not flexibility, there's some variations of when students can return. There's a lot of communication, and of course, there's a lot of frustration because some of the students that are out are well and they're struggling. And then sometimes when those kids get tested, they may develop symptoms, the close contacts may develop symptoms. And then when we learn that if they turn positive or get tested and positive, now we need to contact trace those students. So sometimes things get, I'll say, spun up a little bit because now we have to go back and repeat the work. So Dr. Lockett, I'm assuming that's kind of the process you want to talk about. And you know, the burden of that of, you know, identifying the students, informing the parents, and then ultimately our responsibility, educating the kids, is tough on everybody. It's tough on the families. They've got to adopt work schedules and things like that. So a lot of moving parts.
Mr. Streeter, can you explain to people what the nurses actually do in their day? Because when I was teaching, they had a full-time job taking care of Susie, Johnny with scrapes, cuts, bloody noses, black eyes, cuts and sneezes, and they need to come in and get their medicine. Now, explain their day.
Sure.
Because I'm very concerned about that.
Thank you, Ms. Herbert, for bringing that up. But our nurses were busy before COVID. It was a full-time job before COVID with a very packed day. The intense needs of our students, we have students that have, medical needs, tube feedings. Our diabetic care is critical. We have a lot of students who have diabetes. We have students that get medications during the day. So in addition to those, I think a lot of us think when we were in school, we think about the kid who fell, needed an ice pack or something like that, and certainly that's part of the school nurse's responsibility. But we also have a lot of kids who get medication during the day. If you think about our younger students who are diabetic or newly diagnosed, there's a lot of education that our nurses are doing with that student so that they can learn how to manage their disease. That's a tremendous effort, and it's a team effort with families that we do. So our nurses are managing all those aspects of their job, and of course being there to serve kids as situations come up. And then on top of this, they're navigating students who are sick, and then the quarantines and contacting families and whatnot.
Thank you. Dr. Dorsey.
Oh, I just wanted you to repeat, I missed a little bit of the scenarios you had talked about from the days of exposure. You were saying that a 5-day window
Sure.
for testing and...
Sure. So from the date of
And
exposure...
Carl, before you start, I'll remind our listening audience that the protocols that Carl is speaking from have been on our website the entire time. So there's a flow chart that you can follow for all of this, for every little scenario
Yes.
that exists. Okay.
Yeah, it's our decision aid was the technical term for that. So Dr. Dorsey, from the date of exposure, the student would look at last date of exposure, 5 days, and then they can get tested. So if a student, I'll use the scenario, students in school Monday and feels fine. And I think one of the other misconceptions is all these cases result when sick children are in school. That's not true. The kid could be in school Monday and feel just fine. And then the kid could get sick Monday night. The student then Tuesday, parents keep him home and get him tested, or they go Wednesday and maybe they find out the student has COVID on Wednesday. We look at when the kid was last in school. Symptoms started Monday night. Well, that's better for us in a way because now we're just looking at Monday. We go back Sunday, Monday. We go back 2 days and identify any of their close contacts in the school setting. Those students are identified as close contacts. We look at 5 days from the last date of exposure that they can get tested. If they get a negative test and are asymptomatic, they can return on day 8. Because the guidance, and this has been a little bit confusing for a lot of people, the guidance says that after 7 days they can return. So after 7 days is day 8. So we kind of have operationalized that. If they choose not to get tested, they can return on day 11 because they're in quarantine for 10 days. The only exception to that is our students who are fully vaccinated, and there's also some confusion about that. Maybe a student has gotten their second shot, but it hasn't been 2 weeks since their second shot. So fully vaccinated is 2 weeks after the second shot, which we do put in our weekly symptom reminder email to remind parents of what that vaccination protocol is. As long as those students remain asymptomatic, they can stay in school.
Commissioner, okay.
I would just say that's a huge advantage for our students who are fully vaccinated.
Commissioner Frazier.
Yeah, I just have one quick question. Are the protocols that we're following for quarantine the same protocols that all the other systems throughout the state are following?
Yes. There are, in large, yes. There's some tiny nuances with different pieces that we work with the health department to write our decision aid, because we really base that off of the Maryland Department of Health, and we also look at CDC guidance. And our attempt is to make that as clear as it can be. The Maryland Department of Health has a decision aid which looks a lot like ours, but ours is a little bit more spelled out, because our goal is to inform the public of what actually our protocols are, instead of having to click 18 hyperlinks.
So basically, the protocols we're following, everybody else in the state were set up by, or came down from the health department.
Yes.
Okay, thank you.
Right.
Dr. Lockhart.
I would add to that, yes and no. We're recently now starting to see at least one change to the protocol in Harford County. And in talking with superintendents, as I do very frequently, this is a huge concern for not just us. And so there's a lot of superintendents and school systems and boards of education wrestling with some of these same challenges, and I anticipate we'll see more tweaks or adjustments to, like I said, to maintain the health and safety of folks, but also to keep kids in school consistently, healthy kids in school consistently.
Anybody else have any other questions for Mr. Streaker? I do. I have another one. I know these students are supposed to be quarantined, but you see them out and about. You know, you hear so-and-so's quarantined, and I had parents call me that actually wanted to, bring their students to riding lessons, and I said, no, you cannot come until you're back in school. But they're all out and about, and, is that what you're seeing, or is that what you're hearing, or?
Anecdotally, we are hearing that. I mean, certainly we're not running around looking for kids when they're in quarantine. I
No.
want to be clear about that,
No.
Mr. Herbert. But what we hear often is, some of the students, and a lot of this is driven by families' need to work. So they may have other people watch students while they're in quarantine, and, maybe there's one family who's watching a couple. So we've heard of those situations, and certainly we're aware through, we hear a lot from our community, and sometimes we hear frustrations from community members saying, we know or we believe a child's in quarantine because they haven't been in school, but yet they're playing youth soccer. What can you do about that? And our answer to that is that's not a school system thing. Youth soccer has nothing to do with school. You might reach out to the health department. So we are hearing that there's lots of times that our students in quarantine are not just hunkered down at home, fully quarantining.
Yeah, because this is a burden, and it's affecting so many people. It's affecting the students, the teachers, the parents, the nurses, and the list goes on and on. Parents need to work. And Mr. Kyler did say that this quarantine was going to be our biggest problem for this school year, and it's spot on. So that's why we need some help. Mr. Kyler.
And to kind of piggyback Dr. Lockhart's comment about the other jurisdictions, and you hear from a lot of them, what concerns me, I mean, for Carroll County, it's ugly. I hate to see healthy kids sitting at home, and Ms. Herbert, you're correct. They're still doing their other activities because they're testing negative and they know they don't have it, and I don't blame them. But one of my issues, when I hear other counties talk of quarantines in excess of 2,000, it's probably 20, 25,000 healthy kids sitting around Maryland with negative tests that can't go to school. And I understand, I almost said I understand the fear. I don't. I understand the concern, but that many kids not being in school is just, we're doing them a disservice.
Dr. Lockhart,
Just checking to see if there's any
Okay.
other questions.
anything else?
And also, Ms. McCabe has invited
Yes.
Whitney Warner, who's the principal of Westminster Elementary, and Jamie Carver, principal at East Middle School, to share, just again, for some more context for the board and for our community, some of the associated challenges along with what Mr. Streaker has described. Mr. Carver, you should see some earth moving over there in the next month, maybe, I think. That's exciting for East Middle School with construction beginning.
Yes, I hope so. Hope
Yeah.
to see it in the next few weeks,
Yeah.
sometime in October.
Right, very good.
So-
Ms. McCabe.
So we know that our schools have been very stressed to handle the quarantining procedures that we have in place right now. And so I'll give each of them just a couple of minutes to talk about how our current procedures are impacting administrators, nurses, and the other staff in the building, as well as our students. Ms. Warner, would you like to share first?
Sure, thank you. I would like to share, our concern with, first I want to start with our students and the consistency that they're lacking for those who have been quarantined for quite some time and some even a second time. Especially at the elementary level and our younger students, some of these kids we've seen have to be quarantined and come back, and we're starting at day one all over again with our younger kindergarten, first grade, pre-K students who hadn't been in school until this year, and we're starting at square one again when they return from quarantine. My entire pre-K class needed to be quarantined, and it very likely could happen again, and we could be looking at weeks and weeks of these kids not being in school. It just interrupts, obviously, their instruction and their consistency, the continuity of their schedule, their instruction. The teachers are, doing the best they can to get assignments into their Google Classrooms. But as we see more and more students being quarantined, it's very difficult for them to keep up putting those assignments in because they're specific to those students who are out. They're not just dropping in what they're doing in the classroom. It looks different. So they're trying to differentiate and drop in the assignments for all these students that continue, that are quarantined. That's definitely a strain. Lots of phone calls from parents to help them understand and get through this as well. I want to share too that at my school, and I was just kind of looking at numbers yesterday and having, say, roughly out of 60 healthy kids that we had to quarantine, out of those 60, I only had one that ended up being sick. And so that was 59 kids at home who were healthy, as you were stating earlier. And we are all working round the clock for these students, nurses, our secretaries, administration, media specialists, teachers, trying to get the computers, the Google Classroom, everything set up for them. And like I said earlier, with our students this is their first time, pre-K, kindergarten, they didn't use Google Classroom last year. So this is their first go around at it, and they're not used to it yet. So again, it's just like starting from square one and then going back again, consistently. So we do have a concern with that, the workload as well as what it's going to do to our students when they're repeatedly quarantined. So as we're looking into the future, it's very concerning.
Thank you. That's a very interesting number because people have been asking us, you're quarantining all these students and how many actually turn out positive? And that's, wow, that's
Right, and I think my numbers might even be lower than like a middle school or a high school. I have 540 kids roughly in my building at the elementary level, and so we're, like I said, about 60 kids, healthy kids that were at home.
So can I ask, your quarantine facilitator, is that person actively involved in the?
I had to re-advertise because when we advertised for that, I had two candidates. One was no longer interested, and one was hired already in another building. So I had zero. I re-advertised. It actually closed today. So tomorrow I should be able to look into possible candidates for that position. So that, again, I should have mentioned that too. That's workload on my staff because I don't have a quarantine instructional assistant yet.
Right.
Dr.
and
Lockhart.
I'll add to that, Ms. McCabe and I and the directors have been talking a lot about this. People have been trying to pick up the slack where they don't have that. So somebody is getting pulled off of something else to do it. And that's tough. And right now, there's shortages with just about every position you could think of, from bus drivers to instructional assistants, to classroom teachers, to special educators, to nurses. So there's not the bench that once was, because as you can imagine, and we can stipend all sorts of things for folks, but I think folks also need balance and need, they need to find some balance with their lives, and so it is tough to find people right now. These two can certainly attest to that. Not like it once was when it was pretty bountiful. And you've got to think, some people are probably thinking, I don't really want to go into a school right now. So,
Ms. Savigny.
Dr. Lockhart, can you give us an idea of how many schools do not have a quarantine coach? Because we've heard anecdotally that significant portions of the kids that are home in quarantine have not had the quarantine coach support.
Before Cindy goes, like I said, we've been looking for these folks since the middle of August. Schools are trying to rob Peter to pay Paul if they can't find somebody out there who wants to do it, to pull somebody off of something else to cover parts of that, and it has been a challenge.
So last week, it was still about half of the schools had not been able to hire a quarantine coach. And so, because of that, we have staff members who are responsible for doing other things now doing the quarantine coach's job, and teachers are picking up a lot of those responsibilities themselves as well. And we also have teachers who were asking to tutor our students who are in quarantine after school virtually. And so many teachers are taking us up on that. Some are not, because as Dr. Lockhart said, we have staff all over the school system who are working long hours, late hours, and are making the decision that even at the larger amounts of money we're paying per hour, they have to set a limit at some point and spend some time with their families on the evenings and on weekends.
Is that across the grade levels?
Yes,
So the middle, high, everybody's?
everywhere,
Okay.
yes.
Ms. Battaglia?
And
Now, make sure you use your cards,
I was
please.
gonna say that, I've seen some chatter from some teachers on social media about how it's hard for them to, when they get notification of students on quarantine, they get all this stuff together, they email the parent, put the stuff on Google Classroom if they have on Google Classroom. The one thing they definitely don't want is to go back to hybrid. They don't want to go back to an all virtual programming because it's even harder. And I don't want to do that. We hear a lot of, well, how come you don't have a virtual option? It costs money. You have to have the bodies. If we don't have the bodies for our quarantine coach, we're not going to have the bodies for our virtual teachers. So there's a lot that goes into it. And it wouldn't just be, here's a virtual teacher. It'd be, again, same thing with the quarantine coach. The teacher's got to get with the parent, let them know, hey, I'm going to do everything. They got to notify the quarantine coach. This is everything for the student. Try to make sure they're communicating with the parent back and forth. So it does cause a lot of stress to it. And there is no easy answer. I mean, this is the unfortunate part. We want our kids there, but this is also the unfortunate part that we're stuck with. I mean, there's no wiggle room. I mean, that's the unfortunate part when we have things that are mandated by the state and we have no wiggle room on. So I do appreciate everything that you guys are doing, your staffs are doing, all of our teachers, all our parents, we're all holding on by a thread right now. My kids just got out of quarantine. I just went back to work, so I completely understand the thread that everyone is holding on to.
Commissioner Frazier?
Yeah. Just wondering, even if you had a coach at each school, is it realistic to expect that one person to give out the assignments and all the online things for kids from a variety of different subjects and classes and grade levels? Because I don't know, but it seems like a lot to me. And I understand there's a shortage of people and all, but even if we went and if we had someone for each school, is it realistic that that person can actually do that job? I'm just.
Yeah, in the places that we have the quarantine coaches, they're working out well. They're doing good work, and they are able to, for the most part, make sure that our students are getting what they need. I think our biggest concern is the number of students that we have in quarantines at any one time, and the fact that certain students might get quarantined more than one time. And then at some point, you're right, no matter what the quarantine coach is able to do, you have students missing quality in-person instruction, and that's difficult to make up with a quarantine coach, with a tutor virtually after school. it does become difficult at some point.
Ms. Savigny?
Yeah, and to your point, Commissioner Frazier, I think that's a great question. You know, at what point do we max out on the capabilities of the quarantine coaches, even if we did have them in every building? If you look at your situation, you said you have 60 kids on quarantine. That's more than 10% of your student population that is quarantined, but only one child actually got sick. I think we have to look at the effectiveness, like what exactly are we trying to control and how effective is this measure? And if it's 1 in 60, you know, one could argue that that's not particularly effective use of any of these resources, and it's certainly very detrimental to our students' learning. So I think all that has to factor in.
And it states that we need to change our quarantining when you have a percentage like that. Dr. Lockhart?
Right, and just for the record, appreciate all the responses to Commissioner Frazier's question. It's not the expectation of the quarantine coach to put all the assignments
No.
on the Google Classroom. The classroom teacher does that. The coach is there to support students who need that. So, but that puts a lot of work on our teachers as well in that process. I wanted to make sure Mr. Carver had the chance to speak.
Thank you. I'm probably going to reiterate pretty much what everybody said. It's, when I first look at it, it's my nurse. The nurses are way overworked. You look at the amount of time they put in. My nurse probably doesn't leave before 6 o'clock every night, which the amount of her emails and her phone calls don't stop all day long. And she comes in the morning and she's got a whole list of emails to go through. And it could just be a parent saying, I think my kid has a cough, should I send him to school? Well, she has to contact that parent, so she's taking time to do that. They haven't had time to do all the normal things they do, whether it's our diabetic students, the normal kids coming in for their meds, whether it's for middle school or 5th grade new students that are now with us in 6th grade, going through all their files and making sure everything's set up. Is there emergency care plans going on? Keeping up with all those normal day-to-day activities that are normally already hard enough to keep up with are almost impossible to get to. For example, we're talking about the quarantining of our students. If I could probably give the best example, beginning of the school year, we rarely have a lot of absences. Kids are excited to be there. Nobody in a regular normal school year has any illnesses that have gone through yet. In a school, I have 760 kids right now. I might have about 20 students out in the beginning of the school year as we go. I have not been below 108 students absent for the last week and a half, and 108's been my lowest. I've been up to close to 140 absent. I think if you look at our data dashboard, we're at 6 total positives over the last week or so, and we have many kids out on quarantine just do that. So when you kind of do the same math of if I have 6 positives right now and we have well over 100 kids out, maybe take away those 20, you know, we're still at 80 kids out, which is still more than 10% of our population.
Dr. Lockhart?
I was just going to see if there's any other
Anything else?
question. I appreciate all that
Thank you.
you all and all of our administrators and particularly our front office folks and our nurses, as we've discussed, and certainly our teachers, are doing and giving us a little bit of context for the conversation tonight. Thank you.
Thank you so much.
Thank you.
Thank you so much for coming tonight.
So, board members, I think I wanted to lay out some of that context just to describe in a little more detail just what some of those challenges are, and I think we all recognize those. And I did want to have an opportunity for our Mr. Singer, our health department director, to be able to talk with us. But one of the things I think we agree is, while keeping student safety and health paramount, we do need to consider some changes here to the protocol. I did speak with the superintendent in Harford County. They recently made some changes that I would support, and that is looking at only quarantining close contacts of a positive when the student who's a close contact is symptomatic. I think that would, we're all in masks. We are going back as we speak, looking for where do we have any additional space. We're already trying to spread out what we can. We're still running all our cleaning protocols. the the HEPA-grade air purifiers in every classroom, hand sanitizing. We're constantly monitoring health conditions. My goodness, everybody in here who's a parent of a student gets the email every week about what you should be looking for. So everybody is keenly paying attention to that. But I would like to see us moving to the quarantine when we have symptoms. And I think instead of 1,400 and growing, we'd be able to significantly keep, we'd be able to change that so that we're really getting at, obviously, anybody who's COVID positive is going to be quarantined and following that protocol. That doesn't change. But we'll be able to keep more of our healthy kids in school. And we are constantly looking at this all the time. And where we do see issues or concerns or outbreaks, we've responded appropriately. And we have now we have the experience to be able to respond if we do see something out of the ordinary or a potential significant outbreak like we experienced at Northwest. We have the tools in our tool belt to be able to contact trace, to quarantine, to do that. And along with this suggestion, we continue to notify parents, your child was a close contact, and so we're going to make sure that they're aware of that, as we've always done, but they don't necessarily have to quarantine unless A, they choose to, or B, they begin to develop symptoms. So we're still notifying everybody. We're still following, Carl and Mr. Singer would tell you, we're still following all of we're gonna see who all the close contacts were, and we're gonna keep that in case that we do end up having an outbreak of any kind. Then we already have all that information and are already ahead of that, and we'll continue to monitor that. But that's what I wanted to talk to the board about tonight, because I think that, and we'd obviously want to watch this, and I want Mr. Singer to speak to it as well. We would watch that and work with our health department partners to make sure that it's working, that we're not seeing significant increases anywhere or any kinds of significant outbreaks. So I'll stop there, I'll pause there, see if there's any board response, and then I want Mr. Singer, if he would.
Ms. Battaglia.
And I think it's another thing we need to clarify too is regarding symptoms, because we are in allergy season, and plus a lot of us, with having to wear the mask again, we develop the allergies of that. You get a hair, you cough, you sneeze, you get itchy throat, and that's another thing I'm hearing a lot of is, they have a doctor's note stating it's allergies, or just the wind blew the wrong way. I mean, and that's unfortunately this is part of the issues we're seeing too, is they're being sent home for potential allergies.
So we do still, our current practices are that if we have a student who has symptoms in school, that we would send them home. And while we definitely have kids that we're sending home that it may be just allergies, we've had plenty of kids who just had a little sore throat and it tickled them and they didn't think it was a big deal, and 2 days later it was something and they had COVID. So that's why those rules are in place. We would ask parents to not send their students to school if they were symptomatic. And if they would be symptomatic in school, we would be following based on what Dr. Locker described, I believe we're following the same protocols. We would send a student home and let the parent know there's just a couple options. They can keep their kid home for 10 days because that's what the quarantine would be. They could go to a healthcare provider and get an alternate diagnosis with a healthcare provider. We actually have a form for that the nurse could provide the family, and the doctor could fill out. The child has seasonal allergies. It's important when we get that kind of gives us a range of time. These symptoms are expected between now and maybe I'll say November 1st, just to make a date up, but like through the first frost, because it's seasonal allergies. Mm-hmm. It's a struggle when we get somebody to say, well, the child has allergies and it's from now till June 22nd. I mean, that makes me wonder, just question that. And at the end of the day, these are questions we're asking the healthcare provider. So the children can get an alternate diagnosis, and we are getting those in, and we're trying to educate the parents. Same thing we did last year. That's not different. So if we have an alternate diagnosis, that allows us to operate without sending the child home that's symptomatic. and we would revert back to what our typical practices were pre-COVID, were fever. So a student had a fever, it doesn't matter what alternate diagnosis you have. If you have a fever, you have to go home and be fever-free for 24 hours without fever-reducing medication. That's how it works. So that's a whole different piece. But I do think it's important that our families know to keep their children home if they're symptomatic. And then we still would stand up our testing at Westminster. I would imagine one of the frustrations that we've heard from folks, we only have so many people there to do testing, and there's not a whole lot of testing available. And statewide, that's not unique to Carroll County. There's just not a lot of testing statewide available. We appreciate Mr. Singer's help, like at Northwest, when he notified us and said, we need to push the pause button. I think it's important to let folks know Mr. Singer's team reached out to Carroll County Public Schools and said, Houston, we have a problem, to steal a line from a movie and probably something that happened in real life. So they notified us, and then we put things in place, and then they supported that testing and, drove I think Ed just likes to drive the RV, to be honest. Is that right, Ed? So, anyway, from a testing perspective, I do think moving into this, if the board chooses to go into a different quarantine procedure, that will lighten up the demand of testing and probably make it more available for students who are going home that are, symptomatic. And if that student gets a negative test, and I need to be clear about this, under our current protocols, the student that's symptomatic that gets a negative rapid, I think that's a relief to the family, but they can't return until they get a negative PCR test. That's the protocol that we have. In general, if you have symptoms and you get a negative rapid test, the PCR test is done as a follow-up just to confirm. So it's called a confirmatory PCR. That's the language that's used. If that test is positive, there's no point in giving a PCR test.
Right.
So
Right, 'cause
I just wanted to clarify,
Or
as
you
you
have
said, people are sick.
Or you have the alternate diagnosis from the
Correct.
doctor.
The alternate
right.
diagnosis is fine, so that's going to a healthcare provider and getting that. And we're working with families on those. And I think a lot of that's educating folks and getting them to go to their doctor and, engage. And, doctor's appointments are tough to come by too right now. So,
They are.
but that will help us, I believe, keep kids in school, which is our priority. Education is, I think, why we're here. And it would keep kids safe, getting kids in. They might be out a day or two, but at the same time, we wouldn't be quarantining. And we're not currently, clearly to say this, we're not currently quarantining kids who are close contacts of symptomatic kids. We are only quarantining students who are symptomatic of positive cases. So we aren't quarantining kids now that if the kid goes to the health room and has symptoms and is going home, we're not quarantining anybody right now.
Dr. Lockhart?
Right. Well, all of this conversation makes me think about we're entering into not only allergy season, but cold and flu season as well. And things could really get compounded here, which is why I think this, makes some sense, because we're not going to be able to keep a consistent educational program for our healthy students.
Yes. And if I can say, we just sent out information about flu clinics. We'll have flu clinics at every school. So those people listening, we are doing flu shots at the school as usual, and multiple emails have gone out about that. So sign your kid up for that.
Thank you. Ms. Savigny?
Dr. Lockhart, I just wanted to ask about, so if we did change to this only quarantining when the student is symptomatic, would that apply to the 1,400 kids who are in quarantine at the moment? If they are asymptomatic, could they come back prior to whatever the 8-10 days are?
I'd need to look to Mr. Streeter, Mr.
And I think that's a
Singer.
discussion for the board to engage in with Mr. Singer. My instinct is when we put that in place, and I do want to mention that putting things in place, one of the challenges we have, even in some of the small nuance changes we've made, that have had, changes with guidance, is, we would spend most Wednesdays with our nurses last year when we didn't have students, between them giving vaccines and getting caught up on paperwork. We also trained them and had great dialogue with them for them to be able to share, this is what I encountered, and they could learn from each other. I say that because any change that we're going to make, we're going to need a little bit of time to get in play, because we have to provide that direction to our nurses. So, Ms. Savigny, to add to that, that would be part of the question that I think we need to land on. I think the first goal is land on what is our protocol going to be, and then subsequent to whatever that is, how do we respond to students who are currently affected by our current protocols and what that would look like. So definitely a question. I think it would make sense to me, from, if you want my take on that, that students would be released. Any student who wouldn't be quarantined tomorrow who's asymptomatic, why would I keep a kid out that's out now? That's how I would look at it whenever we would put this in place.
Okay. All right. Mr. Singer?
Yes.
Mr. Singer, come on down, please.
Oh, boy. I'm gonna come up here and sit, because I figure I might be up here for a while.
How are you, sir?
I'm doing okay.
Good.
Is that on?
The red
Now
light's
on?
on. If
Is
the
red light
light's
on?
You're on,
I don't see a red light anywhere.
maybe.
Either way I turn it, I don't see a red
I
light.
think
There.
you're on now. yeah.
You're on now.
Okay, great. I'll turn that one off then. I guess, I certainly understand the situation that you're in, and I've had some discussions with a number of people about, when I was in the military, we kind of did these risk assessments, and you have to take a look at what the relative risk of things are versus what it is that you're trying to accomplish. And I think a lot of times with this pandemic, we've looked at, what's the safe and healthy thing to do on that side, kind of in a vacuum. But I guess I'm going to go ahead and give a little bit of the other side, and then we can have some discussion about what we want to do about it. I know the school systems statewide are struggling with the numbers of students in quarantine, as we are here locally. The health department and I want to work with the school system to find a way to reduce the impact on the in-person learning while still protecting the community from the spread of COVID-19. We need to find a way to balance the public health and what's best for the school system. So, last year we had a number of outbreaks, but they were generally just a couple here and there in classrooms where you might have had one index case and you might have had one or two other people getting sick. This year it's been a little more complicated for us because we've had some outbreaks where it's led to multiple people getting sick from one index case, and then we've had outbreaks off of that where some of the people who got sick made some other people sick, and that has been happening. I think it's a little bit more problematic because we've got more people crammed into school this year, and also this Delta variant is spreading much more amongst the kids, and there's, I don't think any of us knew we were going to see this. The cases in schools don't just affect people in schools, though. I'm personally aware of several cases of students who got COVID in schools, and they've gone home, and the whole family's become infected, and that's been happening. I don't like to overly sensationalize things, but we have had cases here in Carroll County where a child has gotten COVID in school, or somewhere else in the community as well, and has gone home and given it to an older family member, and that person has died. But that doesn't mean that what we're doing with our quarantine procedures is necessarily exactly the right thing. We've got to kind of, as I said, balance things, and I just want to point out that those things are happening. Our transmission rates are pretty high off the chart right now. The number of cases we had for the kids under 18 are at the highest point that they've been in any time during the pandemic. And in fact, the number of cases we had in kids under 18 this week was double what we had any time last school year. So, and that's primarily where we're seeing these cases right now are in the younger kids. Quarantine and isolation requirements. One thing I want to talk about, because I've gotten I get just as well. I don't know if I get as many emails as you guys do, but I get a lot of emails from people who are unhappy about quarantine and isolation procedures and things of that nature. But and a lot of people think that they're different for private schools than what they are for the public schools, and they're not. We're doing the same thing with the private schools as we're doing with the public schools, and there have been outbreaks in the private schools, and we've had to send people home on quarantine, and we're dealing with those as well. I know I've heard you guys talk about your staff. None of this is easy on either of our staffs.
while school nurses are overwhelmed, our staff are working equally hard trying to pull all this together with the system-wide information and deal with the outbreaks and what we do about that and providing advice to your staff. And in addition to dealing with what's happening in the community, including long-term care facilities, child care facilities, colleges, and managing quarantines and isolations that just aren't related to the school system. We're still issuing quarantine and isolation orders for people in the general population. We've had a lot of problems recently with various outbreaks in different places in the community. Our case rates and positivity rates are actually, a lot of times we like to think that we're a little different here, and we've had good numbers from time to time. As I sit here today in front of you, our case rates and our positivity rate are above the state averages. So, and I want to point out, so I tried to think about what have we done to try to help things with the school system. Well, we've reduced. Carl talked about our quarantine and isolation procedures, and the CDC gives you the option of reducing quarantine from 14 to 10 days. And as soon as that was out there, we made that available to our school system. Not all jurisdictions are doing this, and we're also allowing that 7-day to test out, and not all jurisdictions are doing that. And we're also trying to make it easier if the kids aren't symptomatic, that they don't have to have a PCR test, that we will allow them to have a rapid test to return. So we're trying to be as flexible with those kind of things as we can be. My point is that we're not trying to be inflexible, and we want to work with you all to come up with a good solution. The other thing I want to point out is I know you guys are struggling with testing. This week we stood up some additional testing at the health department that we're running out of our parking lot. What's really difficult for us right now, and I've been talking about this a lot with the Department of Health, is we've got to run our regular health department services, and we're having the same problems you are in trying to find additional staff and trying to find space and people to do booster shots, and we're going to have pediatric vaccinations coming up and do testing. We're all struggling to make this work from that perspective. So, ideally what I was hoping to come here tonight and talk to you about, and I talked to Dr. Lockhart, and I have been back and forth about a few ideas. I really would have liked to seen us come up with a workable test to stay type protocol, even with potentially using take-home tests and letting the parents do the testing and then send the kid in with a note that said Johnny was tested today. And I would feel pretty entirely comfortable that if kids got tested with these take-home tests, which are essentially the same tests that we're using in the Westminster site, that we could make sure that kids aren't coming back sick with COVID unknowingly. Unfortunately, I've ordered some of these. It's going to take a month for them to get here, and I don't think anybody's wants to wait for a month. So we've got to talk about what we can do in the interim and where we go from there. But I've actually ordered some more. I'm going to try to get these in, and even as we move on from whatever it is that we decide to do today, I think that there might be a role for those. We realize that we don't have staff and you don't have staff to do a test to return type thing with it being staffed. I mean, I've talked it over with my staff, and we talked about telemedicine, or where could you get staff to possibly do something like this. Actually trying to staff a test to return type program would be, I think, something that the school system nor the health department would have the personnel resources to do, and I don't know where we would find people to be able to do that. I know the secretary's order allows for people with just a GED to be able to do that testing, but you still have to train them, and you have to be able to, I guess, retain them if you were going to run this type of thing, and somebody's got to oversee it, and I think that would be hugely burdensome administratively. So, I got this idea that I still would like to see us potentially move forward with. Maybe it's 30 days from now if we get these pallets of kits in. If there's another way to find them quicker, that'd be great. But I don't think that's likely because everybody's looking for them now. But we did order some. We're ordering more. And, at some point in time, I'd really like to see that part of what we're doing to try to prevent the spread and balance this in our schools. So that said, we can't do that right now. So what do we do in the interim? You guys are really struggling because of all these quarantines. And Dr. Lockhart and I had a conversation today. And honestly, you know, with compromise, I guess it's something where he's like, well, do you think you could live with this? And I'm like, I don't know. And we're back and forth. And with compromise, I'm not comfortable with what we talked about today, to be quite honest about it. But I think it's a reasonable middle ground where we could work something out that would help meet the school system's needs and do the best we can to protect the community. Because it's not just about the kids transmitting it to each other in school and them possibly getting sick. It's the other people in the community that could get sick. And I have a responsibility as the health officer to deal with those issues. What Dr. Lockhart talked to me about today, and I guess, do you want me to go ahead and get into some details of what I think we could live with as a health department, and maybe what you all have to decide if you can live with this as a school board? Because the last thing I wanted to do, and I told him this, the last thing I wanted to do was to come here and have you guys make a motion to do something that I didn't think I could support, and then we get into this adversarial relationship, and then I'd be reaching into those regulations and laws that I think give me authority as a health officer to try to make you do something you don't want to do. So we've got to find a way to make this work. As Dr. Lockhart talked about the possibility of excluding students from quarantine who are consistently wearing masks in the classrooms. And now, what we talked about was doing this for the classrooms only. We can't do this during lunchtime because students are unmasked. We can't do it for contacts that are happening at home because we know that the majority of the people who are getting sick are getting it from somebody else in their own household. So we can't do it for theirs. You know, I did miss one of the points I wanted to make earlier, and I'd be remiss if I didn't say to the people in your viewing audience, if your kids are over 12 and you don't want them to be in quarantine, I understand it's a personal decision, and I'm not pushing for mandatory vaccinations. But if your kid's over 12 and they're eligible to be vaccinated and there's not a medical contraindication, and there really aren't any for this, and you can talk to your doctor about it, but if those kids get vaccinated, they're not going to be in quarantine. So I'd highly encourage everybody who's eligible to get vaccinated, for the parents to get their kids vaccinated, and that's going to help keep kids in school. And we're willing to do whatever we can to support getting people vaccinated. And when the younger kids that are 11 and under are able to be vaccinated, we're going to support that, and we're going to work with the school system on that too. I mean, that'll really help us drive those quarantine numbers down if we could just get more people vaccinated. And I know, Mr. Kyler, you said to me, and I went back and I researched this last month. You said, well, those kids could still get sick, and yes, we're seeing breakthrough cases, and they could still transmit the disease. And yeah, that's possible. But when you look at statistically the likelihood of those kids becoming sick, it's not that they can't transmit the disease, but the likelihood is very low that even if they're exposed, that they're going to get sick. So I'm going to beat the hammer on get vaccinated all that I can because those kids, the reason the CDC has made the decision and recommendation not to quarantine people that are vaccinated is because the vaccine's highly effective and it's keeping people largely from getting the disease. There are breakthrough cases, but you have to look at the relative risk, and the risk of a vaccinated person getting sick is very small. So what are we going to do to try to make sure that we're going to protect the community as best we can? And what Dr. Lockhart and I talked about was we need consistent mask wearing in the classrooms, and that's going to need to be reemphasized with staff. My staff have been out there. We do inspections of the kitchens and things like that, and they're like, yeah, not all the kids in school are taking this very seriously. So Dr. Lockhart's going to have to reemphasize with his staff the importance of enforcing this with the kids. And I just want to share with you guys, and I can send this to you electronically. There was a report in the monthly mortality morbidity and mortality weekly report on a 6-week period in Arizona for their school system. They start in July, and it ran from mid-July through the end of August, this report. And essentially, I'll send the whole thing to you, but what the outcome of the study was that in schools where masks were required at the very beginning, they had outbreaks throughout the school systems, and they had 480 outbreaks. And in schools where masks were required and enforced from the very beginning of the school year, which was middle of July till the end of August, 8.4% of the outbreaks happened in those schools. Where masks were required kind of in the middle of that time period, 32.5% of their outbreaks were happening in those schools. And in schools where masks were not required at all, 59.2% of the outbreaks were happening there. And this is it's 75% of the population of Arizona is covered by the school system. But I do think, I know a lot of people don't like masks, and I know where you guys stood on that. I just do think this type of study shows how effective masks can be. So if we're going to take advantage of this and we're going to try to do something to reduce the number of kids you got in quarantine, y'all are going to have to step up to the plate and make sure that people are doing the right things and to wear a mask properly, because we're going to, as a health officer, I sent you some information. I've got the authority to issue certain types of orders and things like that, and we don't want to get into that. But if we agree to do something differently here tonight than what's in the state guidelines, my expectation is you're going to get students to wear the masks. And if they're not doing it consistently, we're not going to go out and look and say, oh, there's one kid that's not wearing it, and that's a problem, and now we're going to cite you for that. If we can't get the kids to consistently wear the mask, we can't do this. So you all are going to have to make the commitment, and the school system's going to have to make the commitment to make sure that we're enforcing this. And the health department's going to be willing to take complaints from people, and we'll go out and take a look at it. And like I said, we don't want to do a gotcha because Johnny doesn't have his mask on, but we go into school and half the kids don't have the mask on. We're going to issue an order for that school, and they're no longer going to be able to do what we're talking about doing here tonight. And, whether it's, I don't want to pick on any specific school because I'll make the principal mad wherever it is, but whatever school it is, X school, if we identify that there's a problem there and it's consistently a problem there, we'll issue an order, and those kids we're going to go back to what we're doing now, and those kids are going to have to be in quarantine based on the current rules. Again, we're talking classroom only, not lunchtime and not outside when we're unmasked, not unmasked type things, and we're not talking about home contacts that are outside of the school. So it's important to understand that that's the kind of thing that we're talking about here. I would like for you as a board to commit to meet with the health department again in about 30 days so we can evaluate how this is going. Maybe we'll have those home test kits by then, and maybe we can talk about a test to stay program that we would do. We just essentially would give home test kits to people and say, hey, test your kid on day 3, 5, whatever, and we can get them back into school, because we want to support getting them back into school, but we want to make it as safe as possible. So, I'm kind of looking at this as an interim thing that we can do to try to help you get to where you need to be. And then if we could do something better, next month, that would be a good thing to do. I've talked to the superintendent about, we need to have the administrations identify somebody in the school to go back and take a look at the classrooms and spread these desks out as best we can. I don't know that, I know we've said we've tried to take a look at that, but we need to go back and re-emphasize getting the kids spread out as much as we can. And I know none of this is any fun, and none of us are enjoying the extra time some of this takes, but I think it's important. I know the superintendent told me that we've got filters in all the classrooms. I just think we need to verify that. We need to re-emphasize the self-screening that people are doing before coming to school to make sure we're not bringing sick people into the classroom. And then, the other thing I'd like to do is I want to talk to Carl and staff. There's some grant money out there that we're supposed to submit a plan for by October the 16th that has to do with some things to deal with COVID, and maybe we might want to look at using some of that for potentially, and I don't know if you've evaluated the HVAC systems or things of that nature, or whether they might need to be upgraded, or look at other potential mitigation measures that we can put in place that won't be burdensome on staff, that might be able to help cut down the possibility of transmission in the schools. So that's kind of where I think our discussion has led us. And as I said, I'm not completely comfortable with it, and I'm sure there are people out there that won't like this if we ultimately implement something like this. One of the important things that I'll say to you as a board is we do need to think about, or you need to think about, because this isn't really my area of responsibility, but it is something I thought about and have concerns about. Kids who really have legitimate health concerns, that are immunocompromised or at greater risk, if this does become a concern for them that we've moved in another direction, you got to figure out maybe how you're going to accommodate them, because I hear from these people all the time that we're worried about this and we're worried about that, and it is going to have an impact on a small portion of your student population who this might make question whether it's safe for them to come to school or not. And I don't know what the answer is to that, but I think it's something that we need to throw into the mix if we're talking about that, because all your students are, I think, equally important, and we need to give that some consideration. So is there anything you think that I've missed that we talked about on this, Dr. Lockhart?
No, I don't think so. I'll make a couple comments, and then
Yes, please do.
I'm sure the board would want to have some input. So, I want to make clear that, and, we've got a couple principals here who can certainly chime in if they'd like, but mask wearing is the expectation. And, I will say to you, I'm sure there are instances where it's under a nose or ends up under a chin somewhere, but the expectation is it's back on the face appropriately. And so we don't have an issue sending all sorts of reminders about that so that we can comply with that. And I think there's enough incentive there to do that so that you can stay in school. In terms of finding space, look to the principals again, but we've been saying since the middle of the summer, MSDE wants us to have all the students back. In fact, they require that we provide the opportunity for all students to return 5 days a week. So we knew we'd be challenged. You referenced last year. Most of the year last year, we had half of the students or less in our schools, so we had space to spread out. Looking to Miss McCabe, I think our attendance is, back at, mid to high 90s every day. Most of the absences are quarantines, correct?
That's correct.
Yeah.
Yes.
So, Jamie or Whitney can tell you, they're using every inch of the classrooms, and instead of the traditional, we'll clump students all together. If we're able to spread them out, we'll do that, but we'll certainly go back and see, are there additional things that potentially could support finding more space? I can verify, Mr. O'Neill shared with me at the beginning of the year, we do have all air filters running just like we did last year. That's all instructional spaces, and we also purchased them for the smaller
Yes.
intervention and
Yes.
speech therapy and things like that, those rooms as
Yes,
well.
we did.
Self-symptom screening, Ms. Gaddis, that goes out from your office every week to parents and to staff as well. And we're open to any other mitigation strategies as you referenced.
The one other thing I forgot to address, because it got brought up while Carl was up there, I think we're going to need a few days to put together guidance to implement this. I would suggest that we try to work on this the next couple of days, and I don't know if you guys think it's reasonable. I think we could shoot for trying to implement a new program on Monday. I really don't think, because we weren't trying to differentiate between classroom exposures and lunchroom exposures and things like this. I think we need to live with the kids that are in quarantine now and just make it better going forward, because I think with as much stress as we've put on your staff and our staff in trying to do this contact tracing, to go back and try to resort this out, and I understand the huge impact that it's having right now, but we're talking about maximum of 10 days of quarantine. Usually, by the time somebody's identified as sick, we're 3 or 4 days into this. So most of the folks that are already in quarantine now are going to be coming out early next Monday or Tuesday probably anyway. So I would suggest that let's give it let's try to put this together. Let's try to implement something maybe by Monday if Carl thinks he can work that out with my staff by then. And let's leave the people that are in quarantine. And I know that's what I looked at what was happening over in Harford County, and I know that's what they kind of said. We can't really go back and retroactively sort these people out. I'm really concerned that would be very difficult to do. I think we just need to leave that alone and take it from, if we can get this in place by Monday, maybe Monday going forward, and we come back 30 days from now and kind of revisit where we are, see if it's had an impact. Now, you realize that, you know, if the whole community curve goes in the tank, that doesn't mean that this was successful. It's just, we've got to kind of take a look relative to how the cases are and that type of thing, and what spread we're seeing in the schools versus what spread we're seeing in the community. But we can certainly come back and talk about that. And I really, you know, I'd strongly suggest that we look at this potential of doing these home test kits to really try to put another layer of keeping everybody in the community safe. I'd also suggest that I don't know that the board really needs to take an action on this, because if we agree that this is what we're going to do, we'll go back and implement it. If you feel like you need to take an action, that's fine, or if you just want to make a motion that you're going to support what we've suggested. But that's kind of where I am on it, and let you guys go from there.
Do you want to respond, and then I'll?
Yeah,
sort of
just
grab-
to, Ed, I agree with what the timing wise. I think we've always been transparent about our decision aid that's been public. That takes time. I mean, it really does take time to develop. That's a very collaborative process. It's an iterative process. We take the decision aid, we draft, so we would have to take our existing decision aid, look at the impact of this change, and I think we can, you know, depending upon Dr. Taylor's availability, Ed, and your team, I think we can get that process, you know, finalized and communicated and put in place, because that's our driving document. I think it's important for people. That's, as Dr. Locker earlier said, it's on our website. That decision aid that's public, that's what we use. That's what our nurses rely on. And it will take some time. Like whenever we get new guidance, sometimes, I mean, we're fast tracking to get done 2 days, to be very honest, because there's nuances. We want to make sure it's accurate. So, you know, I think that's important. And another thing Mr. Singer mentioned that wasn't something on my mind originally, when I mentioned the idea of you know, the kids currently in quarantine, thinking about students that may be close contact at lunch versus in a classroom, we can't burden our staff with identifying kids in quarantine now and how they were put in quarantine. What was the location of that child in quarantine? Because in our, what I understand to be our moving forward idea, a student who would be a close contact at lunch would still be placed in quarantine. So if we were going to try to say anybody who's asymptomatic could return to school, we would be ignoring those students who were close contacts to a positive case. And I do want to make sure we're clear. This is a close contact to a positive case, unmasked, less than 6 feet, inside. All those things are the things that spin up the extra possibilities of transmission. So I would be very uncomfortable saying to our staff and our nurses and our administrators, can you go back and look at your line list and identify the students that are on that line list? Which one were in a cafeteria? Which one were in a classroom? I don't think we gather that information now, right? You're not, when you do the line list, you're not specifying, when you get the group of kids, you're not doing, no, we're just, here's the student. So, Mr. Singer, that point that, as you brought that up, made me think about that, and I wanted to share that with the board.
And I would like for Dr. Locker to share again exactly what our changes are going to be
Right.
before we make more comments.
Sure.
So first of all, thank you, Mr. Singer, for your feedback and your collaboration. Right. As I suggested, we want to change the quarantine for close contacts, that they do not have to quarantine unless they are showing symptoms, with the exception of cafeteria and an unmasked time, as Mr. Streaker just shared. We will continue to notify parents anytime there's a close contact, as I stated before, so that if a parent wants to make a decision, I'm going to go ahead and quarantine my child, they can do that. But then that also allows us, we're still following and keeping record of where, if there is a potential outbreak, we're already ahead of that in terms of the work that we've done. But that's the change. And along with the pieces that Mr. Singer suggested, we obviously are going to continue to work on, you know, consistent mask wearing, finding space, the ensuring all the air filters, the symptom screening, all those things that we're currently doing. We'll emphasize those If there are any other mitigation strategies through grant funds or anything that we can take advantage of, we'll want to do that. But we do believe this will help us to keep more healthy kids in school, and we're prepared if we do have a potential outbreak that we can respond to it.
Thank you. Ms. Battaglia?
Mr. Singer, I just want to say thank you for everything that you have done. I know this has not been very easy. It's been challenging on everyone, and you catch a lot of crap from us, and I'm really sorry for that. But, you know, just like you said, you hear a lot from the community as well, and with aggravations and concerns. So I just wanted to thank you for everything you have done, and I heard that you are retiring, and I'm sorry to hear that. But I just wanted to say thank you for everything you have done for the school system, been helping us out in the community. I do have a couple of questions. You had talked about, you know, of course, if you're living with someone that's positive, is it different if the individual is vaccinated or not regarding quarantines?
So are you talking about the individual who's exposed, or are you talking about the individual who's if the person who's got COVID has COVID and somebody's living with them and are in close contact, they're going to need to be in quarantine regardless whether the person who was positive was vaccinated or not.
Okay.
If the person who's living in the house with the COVID positive person is vaccinated, they're not required to be in quarantine. We'd still recommend that they try to avoid contact because we know we get breakthrough cases as much as they can with the person who's sick. It's, you know, I go back, this vaccine's much more effective than the flu shot, and I still encourage everybody to get a flu shot because you don't want to get the flu. But that doesn't mean you can't get the flu. And, you know, we're seeing a really good data that Dr. Taylor shared with me today. We did a lot of the Moderna shots, and the Pfizer's the one that seems to be the one that's most out in front in some of these new things. But we're seeing that the Moderna's holding up very well. A study he showed me today said even 120 days out that it's 92% effective. So back to your question, though, is essentially that it doesn't matter whether somebody who tests positive or sick was vaccinated or not. The person what makes a difference is the person who could potentially be exposed, whether they're vaccinated or not. And people who are vaccinated, fully vaccinated, are excluded from quarantine requirements.
Okay. The second one's kind of more of a comment. I did want to let you know there are some doctors that are telling a positive person, you know.
And I know who one of them is, and we
Yeah.
called him.
Yeah.
So
And that's kind of concerning when you have, you know, the medical community telling patients like, hey, by the way, you know, well, okay, so I'm positive and I'm vaccinated, so what about my kids? Well, as long as they don't have symptoms, they can still go to school because they're wearing a mask. That's concerning, because then you got parents going, wait a minute here. I got this person telling me this and another person telling me this. Well, which one do I listen to?
So our role as a public health department, and I'll kind of answer your comment, is we reach out to physicians and say, hey, you realize what the CDC guidance is, and you realize what the guidance that we're following to try to deal with quarantine and isolation. I mean, the authority for quarantine and isolation essentially lies with the health department, and try to make sure that we're on the same page with those physicians. We try to make sure that information gets out there regularly. We know physician practices are very busy, and during COVID, it's got to be crazy for them. And I think we've got a lot of really great physicians here in our community. I've had an opportunity to work with a lot of them during this pandemic, but you know, not all of them are thinking 100% COVID all the time. And,
Right.
and it seems like that's what we've been at the health department for the last year and a half, almost 2 years. But so we do try to educate the physicians and make sure that they're not giving people advice that's counter to what we would be doing from a public health standpoint.
And then my last question, we've seen a lot, you know, there's been some reports that come out that the current PCR tests that are out, they not just test for COVID, they also test for flu. So would it be a suggestion that if someone gets a COVID test and it comes back positive, that they go get checked for flu at the same time? Now, could it be, you know, potentially like it is flu and not COVID?
Well, so you said if they test positive for COVID, they're positive for COVID. It's possible they can have co-infections, that they could have the flu and COVID at the same time. We're having difficulty getting test kits that would necessarily test for both. But on the physician's offices where they're doing a panel of tests, they can generally get both of those tests. It'll be hard for us at our sites or at the school site to be able to do that, but it certainly would be advisable if you're going to the urgent care or you're going to your primary care doctor, they can get any panel of tests that they want to test both for flu and for COVID at the same time, and that will help with the overall diagnosis of the patient.
Okay, because I think that's another thing we've heard a lot is like some of the PCRs, they're not differentiating the difference. Like it's saying it's COVID, but it could be flu. But I mean, that's something that, I mean, I know I've seen a couple articles regarding it. Those are supposed to expire in December, the original inventor of it, and that's how they based on the test was flu. But new tests are supposed to be coming out to make sure it is separated.
Well, if you take a look at the data on testing, and Dr. Taylor's, he's a great data guy, and you know, I've relied on him to kind of do the research and inform me on that. The accuracy of the PCR test, if somebody's symptomatic and they test positive, it's over 99%. I think it's upward to over 99.5% that the person has COVID. If false positives are almost non-existent when we're talking about people who are symptomatic and test positive on a PCR. So I just, you know, the rapid tests, the antigen tests, there's a little more question about some of those, but I don't know. I almost look at the PCR as being a kind of a gold standard. It's nothing's ever perfect. There's lab errors and there's other things that can happen, but I don't think that we have a problem with misdiagnosing people with COVID that don't actually have it.
Okay, great. Thank you again.
Commissioner Frazier.
Thank you. Okay. Just one or two things. First, you talk a lot about testing, and I have a letter in front of me from Maryland Department of Health that's basically offering some help with testing for school systems. My guess is we all saw this, or you guys got it as well, but we didn't take advantage of it. I'm just wondering why.
We don't have people to
Well,
run it. Yeah.
You don't have people to run the test, but
So
you don't need any more tests?
we took advantage of the testing supplies, and that diagnostic testing is currently stood up right now at Westminster High School. We were one of, I don't know how many counties in Maryland took advantage of that.
We were really early
Yeah.
on the diagnostic testing. We spun that up last year, so we were one of the few systems, I shouldn't say few, but we were very early in the diagnostic. Last year we had it at one point up to 5 sites. We used the concession stands, and then this year space was a challenge, but we were able to use the portable at Westminster High, and our facilities guys built a ramp in a weekend so we could make sure our kids were separated. The testing you're referring to, Commissioner Frazier, is generally it's screening testing.
Right.
And the screening testing, the challenge, we've been on calls with MDH about this. The screening testing, the challenge that we have right now, as we've articulated this evening, is the workload on our staff to identify students who are symptomatic in addition to the regular work our nurses do, dealing with COVID, our instructional staff. The screening testing, you have to have parent consents, so parents would have to consent to screening. From a public health perspective, I understand that it might help identify some cases of COVID. At the same time, we would be in a situation where if Dr. Lockard tested and participated in the screening and he was negative, and Ms. Herbert tested and she was positive, I would be calling Dr. Lockard's parents and saying, you need to take him home. By the way, his test is negative because he got a screening test this morning, it was negative, but he has to go home, he's a close contact to a positive. So the screening the state is providing is, screening testing is just not something that we are looking to do. What we need is diagnostic testing. And there are some iterations that if we have screening in place, they're willing to do some diagnostic. There's a lot of different challenges with that. So we're struggling, and one of the challenges would be in general, our belief is that most of our families wouldn't see a benefit by participating in a screening program, so they'd have to opt into this. Only now, they're going to think, if my kid's not sick, I don't need to be tested. So that is fundamentally the challenge we see with the screening. So we have absolutely gone 100% in with the diagnostic testing. We did that early. We still have that in place. That's the test kits we actually used. Mr. Singer needed, when we needed to use the RV, we actually used some of the test kits we got from that. So we've explored, I would just want to be clear, and I appreciate you bringing up the point because that's something that people are wondering, what are we doing about testing? We are exploring every option that will help students stay in school and learn and be something that we can manage the workload. Nothing's good if we can't stand it up. And I think that's one of those pieces that we just couldn't operate.
All right, I appreciate that. I've been asked this a couple times, why didn't we take advantage of this? And everybody says, well, Frederick County did, and they can screen everybody. I said, well, I don't know the answer, but I'll ask the question.
Dr. Lockhart?
But
I know that a couple other counties are looking at the screening, and it might be in places where they're requiring certain people to either be vaccinated or be screened to either participate in something or what have you. I know my understanding of Frederick is it's being offered as voluntary to their employees who wish to be screened. That's how it's my understanding is that's how it's being utilized there.
And I don't have that information. All I have is that it says 14 public school systems. Frederick is one of 14 listed that did this, and people come to me and say, I'm just putting that out there. One other thing.
Can I just add something on the screening test, and that is that, really, I would highly encourage screening tests if we were going to get a large amount of participation. And I think in order for it to be effective, we probably would need half of the student population to avail themselves of this. I'm not sure that we're going to get that. And that's one of the conversations Dr. Lockhart and I had early on about this. I'd love to see us have screening testing if it was effective and we could get enough people to participate, because that's going to help us limit the spread in school and limit the spread in the community. I think if you sent a poll out to your parents asking how many people would opt into this, just my feeling, knowing people in the community, that it would be unlikely that you're going to get more than 50% that are going to opt into something like this. So, I mean, MDH, I feel like sometimes, and a little bit of my frustration is, I feel like MDH just lobs some grenades at us once in a while and says, well, here's some resources, but it's a question of whether they're the right resources for our community. And so that's a tough one. And I know they've pounded on us about not having enough testing here in the county and not taking advantage of those resources. It's, I'd love to have more diagnostic testing, to be quite honest, because I think that would help us a lot. I'm not sure we would get the participation in the screening testing, and I don't know that anybody's done a poll on it, but just my sense is that it would be hard to get a high level of participation here.
So, Commissioner Frazier, before you ask your next, can I ask a clarification question on that? Can you help me understand what is the difference between, is the test kit the same, whether it's a screening test or a diagnostic test? It's just the program that you put in place to support it? But is there any difference in the test? Like if you're administering a test for screening purposes versus administering a test for diagnostic purposes?
There are multiple different types of tests that are out there, and I'm not sure whether, and I haven't looked enough to see in the screening program whether they're doing PCR or whether they're doing rapids or what they're doing. And in some screening programs, they're compositing. They might take five or 10 students and put them in one test sample to see if anybody's got COVID. I'm not sure where the state's what the state's program exactly is, and we could certainly talk to the vendors if you all are interested. But I think before you do that, you'd ought to get a sense whether or not people would want to participate in a voluntary screening testing, because it's, we don't have much time if you wanted to participate in the state's program, I think till October 10th to try to avail yourself of that. But I mean, there's a variety of type of tests that can be done, and I haven't looked into it enough to know what they're using for the screening. I don't know if you or Carl know.
The pool testing that Mr. Singer's talking about is one strategy where they basically put all the swabs in one thing, and then they'll know someone has COVID, and then they need to further, but they can rule out maybe the 20 kids and say none of them have COVID. That's what pool testing is. That's one thing vendors are offering. Most of them are doing a rapid. The exact kits, I'm not sure, but we have specifically requested, to Mr. Singer's point, we have asked, what we're looking for is not surveillance testing. Could we please have the same resource you're applying to screening and stand up an existing site, like a second site? That doesn't seem to be an option at this time.
Okay, that's exactly the question
We
I
have
was trying to
explored
get at,
that.
so thank you.
Ms. Savigny,
Okay.
we have asked that specifically and said our need is diagnostic testing.
Right.
All the programs that they're offering are surveillance testing with an option that if something is learned through surveillance, they would set up and support diagnostic. We've said we don't believe, to Mr. Singer's point about participation and whatnot, we don't think we have a lot of interest, wouldn't expect to have, especially since it's not a test and stay. Like if you're negative, you can 100% stay. That's not currently in the protocols. You know, that might give us more. If a family said if you participate and you're negative, you're good, regardless of contact. That would, I think, incentivize people to participate, but that's not an option right now, just to be clear. That's not where we are. So we've asked for that. I think it's important for us people to know that we've explored these and had conversations, and the support for diagnostic testing is a spin-off or an addition to screening. So that's why we haven't pursued that at this point.
Commissioner Frazier, do you have any more questions?
Just had one additional comment. If the board moves forward with the recommendations of Dr. Lockhart this evening, my hope, and I guess you've already talked about this, like within 2 or 3 weeks, you're going to reevaluate where you are and that kind of thing. Okay.
Dr. Lockhart?
Right, so to Mr. Singer's request of 30 days, we have obviously our monthly board meeting, so in 2 weeks, 2 weeks from today, we'll be looking at 2 weeks additional worth of numbers. On our dashboard now is not only COVID positive broken down between students and staff in each individual school, but also we have quarantine numbers in general there, so that is there. So we'll have 2 additional weeks. Mr. Frazier, to your point, I think we'd not be waiting 30 days probably at any point based on the number of board meetings that we have. So, so that will be probably at least twice a month look.
And Dr. Lockhart, I just think that, you know, I know you've got the board meeting mid-month, but I'm not sure that we're going to see the impact until we get maybe a little further down the road, because by the time we implement the changes and start moving forward with things, that impact may be delayed 3 or 4 weeks, so.
Understand, and so that look will be ongoing for sure.
Ms. Savigny?
So,
Oh, I didn't, okay.
Dr. Lockhart, could I ask a couple of clarification questions just on the recommendations? So we had said that we would be excusing kids from the classroom from quarantining if masks were consistently worn. Does that mean that the line tracing won't need to be done? For the classrooms, we only need to do line lists and line tracing for cafeteria activity.
Well, we'll still identify who are the close contacts, and we'll still call those people, or contact them, not call, but we think we can do it more efficiently by electronic communication to make sure parents are notified. Your child was a close contact. You don't need to quarantine unless your child shows symptoms. Please continue to monitor your child's symptoms, or you're welcome to quarantine your child if you like. We want to do that because, again, for the overall health and safety, if we do see some sort of outbreak start to develop, then we already have those line lists available. We already know who the contacts were, so we're already ahead of that process.
Okay.
Mr. Streeter's shaking his head, yes.
Can I just chime in again? And that is, other than just, I think it's important that the families are aware, as we talked about this, so that they can, you know, if somebody's been exposed, you want them to be able to at least look for the symptoms. And you might not, it might not strike you as a big deal that Johnny's throat's a little scratchy, even though we're screening kids before they come to school and all that, and we're trying to do that. But Johnny's throat may occasionally be scratchy once in a while, and Johnny wakes up and he's got a scratchy throat and he's been exposed. It's a good time to get Johnny tested, because to know that they were exposed to COVID, then there's a possibility that they're going to be infectious. We want to try to get a handle on that earlier on, rather than waiting when they could wind up exposing other people in the community and other people in the schools.
Okay, so that will reduce the number of healthy kids in quarantine, for sure. It doesn't reduce any of the workload right now on our staff from the effort that needs to go into the line tracing and notification.
In conversation we've had with, administrators about the work, the place that this reduces the efficiency would be the phone calls to families and quite honestly, the frustration and the projection of their frustration onto our staff. Understandably, people are frustrated when they get that call that their child has to stay home. That is consuming an enormous amount of our time and also crushing the humanity of our staff. So I believe that not having to make a phone call to a parent to say your child's quarantined and having that parent, who's frustrated now has a work impact and all that, that's a significant piece because we would be emailing parents and just to notify, closely monitor your symptoms. It's important. We do that even when a vaccinated person is exposed. We say, please closely monitor your symptoms. To Mr. Singer's exact analogy, that sore throat that you might say, if you're a close contact, you really need to take that seriously. We've learned a lot of those have spun up. So that's where we see the reduction. The other piece that we are working on is to work with our tech services staff to try to automate some of this, so we're not actually having to type information. We can do some clicks and have it interface with our student information system. We believe that will also be a tremendous time saver. But the thing that is a tremendous time initiative right now is those calls, calling 30 families, 60 families, which I know both of our principals have done and been part of that team. Those calls aren't 2 minutes. They're 10, 15 minutes. And then, of course, parents are asking about the academic impact. How do I get to work? All understandable. How do I do that? That timing, with the exception of those, what we believe will be small numbers of students because of the cafeteria exposure, would be very, very much minimized compared to what we're doing now.
And along those lines, sometimes it's just not one phone call. It might be the first initial phone call, but then follow-up questions. And sometimes it means it's 2 or 3 phone calls with that. So with this, it could be a little more efficient to Mr. Streeter's.
Yes,
Yeah.
especially if the student's able to, most of them are going to stay in school. So now they're not getting a secondary phone call. Can I talk to the teacher? I need to understand this. We could really put all of our energy into those smaller numbers of quarantine kids where our success coaches to interface with and our teachers to support. So I really appreciate the question because that's certainly one of the things that's very challenging for us right now is the workload on our staff. That's where we believe this would be a significant time saver.
And I just want to make clear, I guess, to the board, what we're essentially agreeing to is classroom exemptions, just essentially taking the CDC guidance that's out there now, and we're deviating from the CDC and the state guidance and giving more latitude to reduce that distance even more in the classroom. And that's what we're talking about. That, those other outside the classroom type activities where there's exposure, the expectation is those kids are still going to need to be quarantined.
Okay, so the cafeteria exposures, even if they're asymptomatic, they still need to be in quarantine? Okay.
I was going to say, I think last year we sent out emails to those that were, just letting you know that there's been a case.
That's correct.
Yeah, so I think so it's basically the same email from last year that we've received. Okay.
Mr. Kyler, I'm sorry, you.
Need to wave it in front of me?
I'm sorry.
A question on what's going to happen, because I want to make sure we leave the night with the most possible kids back in the classroom as possible. It's got, and it's statewide, and the other counties, the county you mentioned had way more quarantines than us, so the stuff, it's rough for everybody. So I'm in a classroom, and she's a positive test. I have symptoms, so I'm quarantined. You don't, you're not. Correct. How do I get back in school? Do I still have to go 8-10 days and all that, or?
So I would think that if you're symptomatic, and that's the reason we're putting you in quarantine because you were close contact, that we ought to be able to test you out of that, because that's the reason we're concerned about you is because you're sick.
Understand.
So I mean, that's a little different than what we're dealing with our quarantines. That the whole thing with somebody being symptomatic, we don't want anybody coming to school sick, really. So if you're symptomatic, and I would think in that case, the reason we're we're not letting you have a quarantine exemption is because you're showing symptoms, that being tested would be sufficient.
And no offense, that was great justification, but had nothing to do with my question. How do they get back in school? Can you please tell me? In other words, a rapid test still doesn't work, or how does it work to
If
get
they're
back in school?
symptomatic, they would be tested and
Test-
have a negative
test-
test.
I'm naive. Tested when? Okay, I'm symptomatic, I
saying-
go home, 3 days later, I'm negative.
I think,
Do I come back to school?
I think what we would need to look at is the date of exposure. I mean, this is where the clinical piece, I would think, comes in, and Mr. Singer would need to kind of add to that. But, you know, if you were exposed today, and were symptomatic tomorrow, I mean, we would hope, if you were already symptomatic in school, you would be treated like any other symptomatic student. Does that, you know, but if we learn that you're positive, because typically,
Yeah.
we're not going to learn that Ms. Herbert is positive while she's in the building. We usually learn that she's gone. And you're developing, if you have symptoms and you've been exposed to a positive case, you would follow our current protocols that.
So nothing changes for those kids?
Correct.
I want people to hear this.
Yes, Mr. And I appreciate that, because that's also what we're trying to do, is get that word out. So if you're symptomatic and you're exposed to a positive case, you would need to test or get an alternate diagnosis, which is the same protocol I explained earlier, Ms. Battaglia, when you asked about, you know, the students with allergies and whatnot. And then those students would be quarantined, and without an alternate diagnosis, the test, getting a negative test doesn't, you know, it's not the day after. You would follow your quarantine for, you know, after 5 days of exposure, you can get tested, and you can return on day 8. And when we think about the disease and the spread, I mean, at the end of the day, if you're symptomatic after being exposed to a positive, we have a responsibility to limit the spread of COVID. So those would be the cases that would be most concerning to us, are those close contacts, because you wouldn't be symptomatic already. It would be like the next day or two. And then that's the importance, too, I think it's important to clarify, of why we're going to gather the information of the students who are close contacts when we learn of a positive case. So that if you become symptomatic, we can then identify, okay, is that an outbreak at the school? Because an outbreak is defined by 2 related cases, which right now I think we have 7 on the state dashboard of current active outbreaks. So we have had transmission in schools, you know, as displayed there. So I think it's great that we clarify that. Those students would be following the same protocols we're following now.
So then, following up on that, so I'm in close contact with her, I'm not symptomatic, and so I get to stay.
Yes.
I'm symptomatic the next day or 2 days later. Because of the contact tracing you've done, I'd be identified then.
Yes, and the important part is that what you're describing is the most
Likely.
common way that we find that you're actually, you know, you're both not positive the same day.
Yes.
You're a close contact. Typically, the symptoms take, you know, 2 to 3 days to develop, and then, you know, and that's when you're actually at the most risk of spreading the disease. If I remember Dr. Taylor's explanation, days 2 to 5 are your most spread, and that's why the quarantine is the way it's set up, that you can get tested after day 5. So that's how that would work.
Okay, and then back to the comment on the vaccines with me. One of my reluctance, because I've been pro-vaccine, any negative we keep putting out about some of this stuff makes some people more reluctant to do it. So I just want to be as positive about it as we can, which we are with how we're treating quarantines now. And I think we need to be positive. Again, I want to emphasize our classrooms, I think kids have been wearing masks, unless I've heard wrong. I think our air systems in our classrooms work. I think we've been doing a lot of very positive stuff, and I want to pat everybody on the back for that. I think we've analyzed opportunities for grants to the hilt. And as far as meeting, I think this board's proved we'll meet every week. We'll meet, I think we met a couple times once the same week. We will meet and reevaluate, but the reevaluation has to go both ways, not just get stricter. Sooner or later, this is probably going to go away if people are willing to let it, and we need to evaluate going down too. And I appreciate the compromise. I know from your perspective, looking at the entire county, it's tough to look at us. Now, I do feel strongly kids are most safe in school. I do feel strongly I can show you a bunch of mass studies if we want to bring those up. I can show you schools 20 miles from here that started optional masks and aren't quarantining and are very successful. That doesn't mean we can be, but but it's a big world out there, and there's a lot of stuff going both ways. And so I think staff, Dr. Locker, you guys are pretty comfortable with what we're discussing, correct? And you're semi-comfortable.
I'm uncomfortable, but.
I know.
You know, we've got to, part of compromising on things, and it makes me really uncomfortable that we're not following CDC state guidance, and that's fine. Honestly, if the state really was insistent that we should be following this guidance, they'd be behind me saying that this is where we need to be. And I haven't been able to get that. I'll be honest, I haven't been able to get that level of support. So I feel like we've got to come to a middle ground, and we've got to work this out. I don't want to, one of the things that I said to my staff, I don't want to have an adversarial relationship with the school system. There's a lot of things that we do together, everything from substance use prevention to dealing with, certain types of other types of diseases that are transmitted. There's just a lot of do hearing and vision and a whole bunch of things we do with the school system that are very important, and we don't want to poison a relationship by one having to strong arm the other one, and who's got authority over what. And I sent Ms. Herbert a copy of the regulations that I think govern this, but I certainly didn't want to have this end in an adversarial where, well, I got to go back and talk to my attorneys to figure out how to overcome what you guys did tonight. So that's why we are where we are. And I think, sometimes when you compromise, you're not going to be fully comfortable with the outcome. And I'm not, but I think it's probably the best we can come up with based on the circumstances. And I do understand the importance of having more kids back in school and the impact this is having on learning. So at least I can feel a little bit good about that.
And I do appreciate and feel for your position, because throughout this whole 19 months, we've seen guidelines, we've seen recommendations, and there's not a lot of support to the county levels that they're either a rule or they're not, or like, oh, relax this one or be strong with this one. These are the guidelines, and it's a tough situation. And I've told you this one-on-one, but it's amazing how you've worked with the school system, how you rolled out the vaccines and pushed those. And as Ms. Battaglia said, good luck getting back to, I think, streams and water and stuff. Good luck with that. And it's been tough. And again, hopefully we've discussed it hard. I don't know that we've been adversarial. And don't want to be either. Everybody needs to work together, but we need to get our kids back in school. And we've said before, you have your job, and you worry about the whole county and all the other things you talked about. We worry about the schools, and sometimes our feelings conflict. But you see how crazy we are with meetings, and you still come to them. So thank you.
Ms. Savigny.
I just wanted to reiterate, thank you for working with us. I'm glad that we're able to have these discussions and kind of think a little bit flexibly, because you started out the conversation with talking about, what is your risk evaluation, right? I think we have to look at how effective these risk mitigation strategies are. And when we've got a situation where we have 7 outbreaks, which is presumably maybe 7 to 20 kids, maybe 2 or 3 in any one of those situations, but we've got 1,400 kids in quarantine. Clearly, it's not an overly effective strategy. So to adhere to it so strictly, I think it makes sense for us to be reevaluating this and trying to figure out where can we be a little bit more flexible and get that benefit to the students, right? So that we're not having the detrimental impact on their education. The one last thing that I did want to ask about was, as we have more kids that have tested positive and have recovered from COVID, are antibodies, is that one of the ways that they can get back in? Like, so if they were identified as a close contact, but they've already recovered from COVID, does that excuse them from further quarantining?
So it's been in the guidance for quite a while now that somebody who's had COVID and recovered from COVID, essentially exempt from quarantine for 90 days. There has been documented cases of people being reinfected, and it's kind of where the guidelines based on studies on reinfection and all are at this point in time. That may be a little on the conservative side, but that's where we are.
Okay. Dr. Dorsey?
I was just going to comment that I think certainly, looking at this in this new way or different way, certainly will have a positive impact on the students. I can certainly relate to what Mrs. Warner and Mr. Carver were sharing, especially at the lower levels where it's consistency. When we can keep kids involved in school in a consistent manner, it's to their benefit. I mean, I can remember when we used to start school the week before Labor Day, and we would get all of our kindergartners in, and they'd have a great first week. And then the day after Labor Day, when they had to return, it was like starting all over again. So again, that's just another example of a break in which our little kids certainly, have some issues with. So keeping them involved on a regular, consistent basis is certainly important. And, I think that's, whenever it's going to benefit the kids, I mean, I think that's what we certainly need to look at. And personally, I've had a grandchild who had been involved with having to quarantine, and I know how tough that is on kids. They find out late, sometimes the night before, that they can't go to school the next day, and not only the next day, but the next several days after that. So they sort of see their little worlds falling apart. Not saying that you can't talk with them, concerning why and all of that. But again, it certainly does have an impact on them. And hearing the statistics from the two schools that were sharing with us tonight, I mean, there were more kids who were well out on quarantine who certainly could have been in school. And adding to that, at our site, we certainly don't have virtual learning. So when we can't offer them something that's pretty comparable, I mean, certainly we're doing the best we can as far as saying, we can get them some paperwork or have them sign into Google Classrooms. It's still not the same as actually either being in the classroom personally or virtually if they had to be out, if they had the symptoms. So again, I think with a somewhat of a relaxing of how we've looked at this is going to benefit those students who aren't showing symptoms, who could very well be in school. I think it's going to be to their benefit. And Dr. Lockhart, when you talk about having the desks spread out, so that would mean that in our classroom settings, no longer would we find the table type arrangements, but, more of the rows and the desks in rows, the way it used to be, I would say in the dark ages, but I know we had to do some of that last year as well. So.
Yes, most of our desks are in rows. There are some classrooms, especially in our early childhood classrooms, where we have tables, we don't have desks to do that with. And then there are other classrooms where teachers have been very strategic about how they seat students in pods, and they seat them in such a way that if a student is positive, the fewest kids get quarantined. And so sometimes that means that certain students are closer together, and then there's larger distances between that group of students and the next group of students. And so mathematically, when you look at a classroom and the square footage that you have, depending on the classroom and the number of students you have and the size of the desks, you take out less students with quarantine if you have small groups of students with more space between the desks. So teachers are trying all kinds of different things to make the classrooms as safe as possible and to quarantine the fewest students.
Okay, Mr. Kyler.
So back to the areas. Classrooms obviously are en masse, buses are en masse, the hallways are en masse. The primary that isn't is lunch and phys ed?
Yes, that's true. And, in phys ed, they have their masks on until they're exerting themselves And most PE classes are taking place outside right now because the weather's nice.
Yes, so right now, they're outdoors. And outdoors is totally different on the quarantining? No. They're outdoors and they're mask-free, but
Correct.
they're still quarantined the same manner.
But I will say that my understanding is that we have very few students we're quarantining based on outside and phys ed because, Ms. Herbert, you know, every good phys ed teacher, they're moving. We want them moving, right? So the likelihood that 15 minutes of sustained, contact is there is minimized in the phys ed setting because the kids are moving in those spaces. So the primary places we're seeing the significant quarantines in the current practices are cafeteria, classrooms, and buses, because just the kids are, close. So by this new procedure, we would only be quarantining the cafeteria because that's the place that we've identified that they can't wear a mask.
Gotcha. And then this question may be more related to the new regulation than Health Department, maybe both. I've been asked by a couple families, if my child's in the school musical, a dance class, anything else with activity, is that considered exercise that they can take their mask off? Some have been told, I don't care if you're dancing, running, you still can't take your mask off because you're not in phys ed, but how's exercise defined and where do we draw the line on that?
So we've talked to Mr. Stewart, who's our supervisor of fine arts, early on when that guidance came out with masks, and he sent communication to music teachers. And dance would be, it's defined as exercise. So that's up to interpretation. I think our teachers need to kind of judge at what point do they, in their professional judgment, see that students are exerting themselves. Even singing, if you're a soloist, as an example, and you're going to perform for a long time, I would say that at some level that's an aerobic exercise. I don't sing. That would be ugly if I did that. But, at the end of the day, I think that's how that's being interpreted.
And before this answer I was given to some of the audience here, I did my standard answer. Did you ask the principal yet? Call your principal. They know everything. They're straightening it out.
Yeah, I would agree. Those questions that come up, that's where they would go. And again, those are judgment decisions based on the activity level of the students, for sure.
Are there any more comments?
The,
Ms. Savigny.
the only last question I would ask is about the quarantine coaches, the fact that we still don't have them in half of our buildings. Is there anything that we can do about that or raise community awareness to try to see if folks are willing to come in and help out with that? Just like we did with volunteers last year, is there a way that we can do like a community outreach to try to fill those?
Yeah, we're talking internally about, maybe different ways to get the word out. I know that our staff, just by word of mouth, have gotten us some of our quarantine coaches because of people they know in their neighborhood, other parents that they're close with. I know that our Human Resources Department is doing a good job of getting the word out on our website and in other places that we're continuing to look for those coaches. So we will continue to be creative to try to fill those vacancies as well as other vacancies. We still have many vacancies in our system for generalized instructional assistants as well as student support assistants. So the quarantine coaches are not the only positions that we're struggling to fill right now.
Okay, Mr. Kyler?
And that was kind of my follow-up question. You answered it a little. For the quarantine coaches and for other positions, what's the requirements? Can that be an instructional assistant? Can that be some of the other people, other employees, or does it have to be a certified teacher?
No, it doesn't. The quarantine coach does not have to be a certified teacher. Anyone who is able to be an instructional assistant or an SSA can be a quarantine coach. And right now, that's exactly who we have doing those responsibilities in our schools where we don't have a quarantine coach. We have other instructional assistants filling in those job responsibilities as well as trying to cover their own responsibilities.
Anything else? Dr. Dorsey?
I just had one more question concerning our number or either percentage of students who are exempted from wearing masks anyway. Remember, there are some
Yes.
exemptions. So do we have a number of students who fall into those categories?
We do. We did last year, and so we do again this year. I don't have any numbers for you right now, but it's a very small portion of our student body. We can get those numbers for you, though.
Okay, well, I was just thinking, like when they're if they're special ed students, if they're being mainstreamed, they would be in their regular mainstream class then, again, without a mask. So it sort of gives a distorting view if someone from the health department would be looking in and seeing a student or students without masks. It could legitimately be that those are the students who meet that exemption.
Yes.
I would just want to add, and we would ask I think if we were out investigating something, if the student had a mask exemption, but if that student happened to test positive, all bets are off on this, and we're talking about the regular quarantine requirements, and we'd be putting kids in quarantine. So, the more we can encourage people to follow the rules and do what's best for everybody and take care of each other, the better off we're going to be with quarantining less kids. And I understand there is a certain portion of the population, but if I also know, and I'll just share this, I also know that, we've had some parents go to a doctor and just say, well, my kid really can't wear a mask, and there's some doctors that might just sign a note based on that. And we really ought to be looking at these from a standpoint of reasonable accommodation like we would with any other thing, and trying to make sure that if we're going to try to minimize the number of kids we're quarantining, the more people we have with mask exemptions that are out there that are unmasked, it's the more people we have potentially putting in quarantine if one of those people gets sick.
Anything else? All right, well, first of all, I want to thank everyone for coming, and when I called this meeting, because of the simple fact that I was so concerned, and this board was so concerned with all of the healthy children not being in their classrooms. I know we were all very concerned about how our nurses were being overworked. We were hearing tales of them not getting home 7, 9, 10, 11 o'clock at night, or they would come home and make calls, and that was very concerning to me, and trying to have teachers continue to hand out homework, put up their Schoology information, and trying to have some kind of semblance of a classroom, but it was always being disrupted. Parents can get back to work. That's a big thing that we all need. And I can't thank all of you enough. Carl and Cindy, you all have had endless phone calls and I'm sure headaches. And I know we do have a little joke about jumping off the water tower, and I'm glad you're all still here because this has been a great group to work with. Dr. Lockhart, you went last week to BZAM and pleaded with the state superintendent that we needed help, and everybody is in this together. We do need bus drivers. We need to be kind to our bus drivers. I know over this season, parents have been yelling at the bus driver saying this child doesn't have their mask on in the back seat, and you've got a second grader in the back and you can't see because the seats are so high. So please be kind, please be understanding. And we need bus drivers, we need IAs, we need coaches. There are a lot of employees we would love to have in our system. So please, please help come fill these vacancies. We are so much better than so many counties around the state here. And I want to thank all these employees for working so hard and our board for working so hard, because this has been one team effort. I'm glad I called this meeting, and I know we'll be having more of these, Dr. Lockhart.
Yep, so thank you, board members. Thank you, Mr. Singer, staff, certainly, and our folks in the schools really, doing the doing there. So we will take these recommendations, work over the next couple of days. We'll aim for implementation on Monday. So that means a communication likely, Ms. Gaddis, on Friday to our community to sort of overview those changes. We will, Mr. Singer, I assure you, we will be following all of the recommendations that you asked us to continue to put emphasis on, continue to monitor. We'll be back on the 13th, that's 2 weeks from tonight, to take a look, and then again on the 30th or close to that date as well.
Can I just add one more thing based on what Ms. Herbert was saying? While you're saying be kind to the bus drivers and everything else, I just want to ask, I know there's a lot of controversy out there about whether people, we're hiding people's face and people don't like masks and things like that. We've come up with this plan tonight, try to keep the kids in school. I just want to get the parents to encourage their kids to do the right thing, and whether you think it's a good thing or not a good thing, if we're gonna keep kids in school, and what we've agreed to here is the ground rules for trying to do that, we need to get the parents to encourage the kids to do the right thing, or we're going to be right back to where we started. So just pleading with your audience to try to make sure we're taking care of each other. We're gonna try to keep as many kids in school as we can, and we need everybody's cooperation to make this work.
Mr. Kyler.
And I'm going to quote you as saying, compromise is good, which it is. If you're going to give, then we need to, I agree. Dr. Lockhart, we've only asked you to do this about 100 times, but the dashboard, because people are going to be looking, if you implement this on Monday, you've got current data up there. A lot of that is multi-week stuff. It's not, the numbers aren't going to drop by next Wednesday because of this, but can you give an indication of how you think the dashboard covers that?
I'm sorry, Mr. Collar,
How many kids, like, what percentage
Put your-
of kids could drop off? And how the numbers went up kind of slowly. They're going to go down kind of slowly, I assume. But I don't know what your feel is on that.
Right. So, yeah, Mr. Streeter and Ms. McCabe and I kind of looked at this, and we look at these numbers every day and all day. This is going to have a significant impact on the quarantine numbers. And the overall goal is still to get the positive numbers to come down. When we don't have positives, we don't have to even think about quarantining. And so, so the hope is, we as a community make a dent in the COVID positive numbers. As this goes for our system, this will impact the quarantine numbers, I think, fairly well.
Yeah.
And I think that impact we could see that certainly in a couple of weeks.
Yeah, I would say 2 weeks would be a good time period to wait to see the results of this decision tonight.
Any other comments? Thank you, Ed. And I know we had our phone call and we did not get the mitts out, and it all worked out. And I thank you for working for us, and as well as us working for you, vice versa. I need a motion to adjourn. By Dr. Dorsey, seconded by Ms. Battaglia. All those in favor signify by saying aye.
Aye.
Opposed? The meeting's adjourned. Thank you. Thank you, guys.
180 performance continues to look good throughout boost phase. Engine's now throttling down slightly as expected. Engine response looks good.
That throttle down reduces the stress on the 19-story tall
At
vehicle.
1 minute, 50 seconds into flight, vehicle is now 10.7, correction, 13 miles in altitude, 7.9 miles downrange distance, traveling at 1,500 miles per hour. Now just under 2 minutes remaining in the boost phase of flight. At 2 minutes, 18 seconds, the Atlas V vehicle now weighs just 1/2 of its liftoff weight. And vehicle's gone to closed loop guidance. Body rates indicating a slight adjustment can be expected for this phase of flight.
There's a beautiful shot right there, looking back towards the planet, and see the plume from the RD-180.
And the reaction control system on the Centaur is now pressurizing to flight levels. System pressure response looks good.
So the reaction
2
control
minutes,
system
50
on
seconds in
Centaur,
flight.
they're prepping it.
RD-180 engine operating parameters continue to look good throughout boost phase. Body rates remain stable.
Coming up in 60 seconds, the
Now
booster
back to 3
engines will
minutes
cut
into
off.
Flight. Approximately 1 minute remaining now until booster engine cutoff.
Our tracker shot getting a great
And now 3 minutes, 15 seconds into flight. Atlas is 48 miles in altitude, 70 miles downrange distance, traveling at 5,600 miles per hour.
shot as it goes out over the southern Pacific.
Pump speeds and injector pressures on RD-180 continue to look good throughout boost phase. And the Atlas V is now throttling to maintain a constant 5G acceleration limit. Engine response looks good.
Speed currently 7,700 miles per hour.
Centaur's begun boost phase chill down. Now throttling to maintain a constant 4.6G acceleration limit in preparation for BECO.
This is where the booster engine cuts off and then separates.
And we have BECO booster engine cutoff standing by for stage set. And we have good indication of Atlas Centaur separation. We have pre-start on the RL-10, standing by for ignition.
And there you see the separation.
We have ignition and full thrust on the RL-10. Chamber pressure looks good. Body rates look good.
Beautiful shot of the booster falling away as you're looking
And we have
down.
good indication of payload fairing jettison.
And you should see the
This
payload
first burn
fairing.
today
Sometimes they come
was
around the
approximately
side.
12 minutes, 11 seconds.